Rainbow Babies and Children's Hospital is Northern Ohio's only Level 1 Pediatric Trauma Center. One of the key reasons this is important is because children are not just small adults. When a 5-year-old has a critical injury, that requires specialized care from pediatric trauma surgeons, from pediatric orthopedic surgeons, from pediatric neurosurgeons, to our pediatric nurses, everyone involved. We only focus on children, and that is what we're very good at. Any trauma, whether it's a violent injury such as gunshot or stabbing, or it's the more routine things from the bicycle accidents to the car accidents, that has an impact on the child and of course an impact on the family. We have specialists here from social work to child life, physical therapy, rehab, that all specialize just in pediatrics. The trauma center is really, it's the whole hospital, and it's the system that we're in, from the pre-hospital personnel that we help train and go back and provide reviews to. So for example, if a child is injured out in Lake County, they're taken to a local hospital, they're initially triaged and resuscitated there, and then our medevac team or even the Life Flight team will then bring them here. We provide outreach and education to that medevac team, to that outside hospital. We'll go out and do a run review for them, to the initial EMS crew that picked them up at home or the accident scene. And that's just the first step to that full spectrum. The next step is then here in the resuscitation bay, which is what people think of when they think of trauma, is this first 5 minutes to an hour in this critical time, but it's more than that. Yes, we can do the immediate medical care here, but from here they're going to move to the operating room, to the ICU, to the regular floor, to discharge, to making sure they have the appropriate services afterwards. You have to make sure that every piece of that spectrum is working well together. And that's the purpose of a trauma center, that you provide that full spectrum of care, plus you're going out and providing education and outreach to the community, and you're providing in-house resources to your own physicians for education. We are that regional resource. We are the ones that are advocating for the care of injured children. We are the ones that are doing research in the care of injured children. We are the ones that are going out and educating the community and providing injury prevention resources for the community. We provide all those higher level functions. Any of the trauma patients that come in, we make sure they have the resources when they're leaving the door to follow up, whether again it's for a violent injury, to make sure they have the appropriate counseling and follow up, or it's because they need to be followed up for their injury. 2,000 children a year die of cancer. 20,000 children a year die from trauma. 50,000 children a year have a permanent disability from their brain injury from trauma. It is the #1 thing that affects all children.